Hi, I'm Cassandra Boyd. I'm the healthcare provider today for Mr. Aaron Patel. His date of birth is 10/6/1982. He's a 38-year-old Indian American who came into the clinic today for a checkup. He's been concerned about his high blood pressure and his type 2 diabetes. He's 5'9", 233 pounds. His blood pressure on today is 146/94. His heart rate is 75. His O2 sat is 98%. His temp is 37 degrees Celsius and his respiration is 18. Mr. Patel's date of birth is 10/6/1982. His medical condition consists of hypertension, diabetes, type 2, and anxiety. He was diagnosed with hypertension a year ago. His diabetes was diagnosed 5 years ago, and his anxiety was diagnosed 13 years ago. 1 week ago, his fasting blood glucose was 210. His hemoglobin A1C was 9.3%. He brought in some readings that he randomly checked at home, and his blood glucose from 2 weeks ago was 220, and his blood glucose from 4 weeks ago that he taken at home was 218. His blood pressure from 2 weeks ago was 144/92, and his blood pressure that he took at home from 4 weeks ago was 142/96. He reports symptoms of increased thirst and increased urination that started 1 month ago. And he's also complaining of tiredness and fatigue and weight gain over the last 3 months. He checks his blood glucose sporadically because he doesn't like the pinch of the blood glucometer. So he's not compliant with checking his blood glucose every day. He has no known allergies and no previous hospitalization. He has been coming to the clinic for checkups, and multiple providers have performed those checkups. He takes prescribed medications at home, which includes hydrochlorothiazide, 50 milligrams daily for his high blood pressure, metformin, 50 milligrams BID with his meals for his diabetes twice a day, and he also takes Lexapro, 20 milligrams daily for his anxiety. He denies any adverse effects from those medications. He states that he's compliant with his medication. With his diet, he does frequently eat out. He denies binge eating, but he does say that he enjoys comfort food when he's stressed out. He denies smoking or any nicotine use, denies alcohol use or any illegal drugs. He has moderate income that he gets from his graduate student stipend. He has a family history. His mother has high cholesterol and diabetes, and his father has hypertension. He is awake, alert, and oriented times 4. He sees and hears well. No problems with swallowing or any throat problems. He denies chest pain and shortness of breath. He has no history of blood clots and denies any problems urinating. He just been having frequent urination. He has regular bowel movements, and he has a sedentary activity status. On this visit with me, he was prescribed glipizide/metformin, 2.5/500 milligrams, BID with meals. He was also prescribed lisinopril/hydrochlorothiazide, 10 milligrams/12.5 milligrams daily. He's to continue his Lexapro at the current dose, which is the 20 milligrams a day. He's to discontinue his metformin 500 milligrams because the new prescriptions will replace that, and also the hydrochlorothiazide that he was taking. He's to discontinue that. He's to report back to the clinic in a couple of weeks for a follow-up visit. And that's about it on him. And he was advised to call the clinic with any questions or any problems.